Chapter 7. Chapter 6 deals with basic interpersonal skills, and Chapter 7 deals with the first time that you meet your client. So let's go ahead and get started. There we go. Basic interpersonal skills. We talked about this last time. A good counselor displays warmth, empathy, respect, and genuineness. Um, I've been around a lot of people that didn't display these, even counselors that didn't display these. I've been around counselors who didn't like their clients and didn't like clients. But we see this in teaching. Some teachers don't really like kids. They don't really want. I don't know. I don't know why they're teaching, but they don't seem to like their students very much. Um, and this is really what we need to do. We need to be able to show warmth, empathy, respect, and genuineness. And if you can't display these four things, then possibly you're in the wrong field. Additionally, a good professional must accurately observe, effectively attend, and actively listen to their clients. Not the easiest thing in the world. You need to focus everything on your clients. If you're focusing on what's going on at home, or you're focusing on your own ego, then this is not going to work. You're not going to be able to understand why your client is having problems. Observing means noticing all behaviors that accompany communication. This type of communication is known as nonverbal communication. You need to observe their facial expressions, their breathing patterns like sighing, the gestures that they give, their movements, and their posture. Being a good observer increases understanding of what the clients are communicating. It can supplement what your client is telling you verbally. It may verify what is being said, or it may contradict it. And the reality is that if it contradicts it, it's probably the nonverbal message that is accurate, and the whatever they're telling you is not accurate. One of the things that you need to understand about clients is that they may be creating shields. They may be using their clothes as a shield to hide behind. They may be trying to fool you into thinking that something else is the problem, because whatever the problem is embarrassing for them, or they are trying to keep it to themselves because for one reason or another. So it's very important for you to be able to read your clients. Not the easiest thing in the world. It takes time. There's no way I can teach you how to read your client. I can just tell you that this is what you need to observe. And if you can observe this, then possibly you can figure out why they're doing this. Lots of different reasons as to why clients are trying to hide things. Sometimes it's really serious, and sometimes it may be a very minor reason as to why they're trying to hide information. This is really kind of an interesting picture. This shows you that this individual's got her legs crossed, therefore she's trying to hide information. He's sticking out his leg, which is a menacing movement. If he does that, it means that he's about ready to move toward you, and that can be menacing. The sunglasses, if they wear sunglasses, it's a shield. It's a shield like I was talking about before. He's got his arms crossed, and he's got his feet wide apart, and this has to do with hostility. What else? Because he's got his head cocked to the side, this means that he doesn't believe you, that he thinks that you're stupid, and of course he's got his hands in his pockets, and that tells you that he's about to leave. Really kind of interesting. Not everybody has these same nonverbal cues, but this is a good basic look at some of the nonverbal cues you may be seeing. Good observers pay special attention to facial expressions. Facial expressions can show any emotion. If the client shows no emotion at all, known as the flat effect, it may indicate depression. I'll tell you that this is a flat expression. This is John Wayne Gacy. He is the individual that tried to assassinate Ronald Reagan back in 1980, I believe. Anyway, he was housed in a mental institution until a mental hospital until after Reagan died. He's out now, I believe, but for decades he was housed in a mental hospital in Washington D.C. Called St. Elizabeth's. I've been there. It's a huge area. And he was one of the only individuals in that whole hospital, this whole block. And he was one of the only individuals in there. And you can see that he has a flat expression, which means that he was depressed. Other indicators of depression include little body movement and slumped posture. If you don't see any expression at all, the flat effect, this is not the flat effect. If they're crying or sighing or looking down, if they have tears in their eyes, this just means sadness. It doesn't mean that they're depressed. Depression is the flat effect. And so this is one of the ways that you can read depression in an individual. Stress is expressed by muscle tension, movement, shallow breathing. Looking away may indicate thinking, remembering, hesitant about talking. Now, the reality is that you have lived your life and you have seen people in your time. So you do this naturally. You already can read people. I can't, like I said before, I can't teach you how to read people, but it may be different for the Dene people. They may have different expressions that they use, or there may be different indicators that I don't know about. So me telling you about these things, these are in general, but of course you are the experts of your own culture, and this is something that that we need to be aware of, is the fact that I'm not an expert of your culture. You're the experts of your culture. You know how your family reacts to certain situations, and I don't. You know how the people around you will behave, the looks on their faces that they have. But this is universal, the flat effect. So if somebody looks like that, you can know that they are depressed. And if somebody looks like this, you know that they are sad. Okay, so let's go ahead and go through these. These are just general. Clenched fists, of course, must be interpreted by the context of the situation and may indicate stress, frustration, anger, or anxiety. The counselor must remember that gestures are culturally developed, just as I was saying, so your culture may see things differently. This is one of the problems with moving from one place to another. A lot of times you're going into another culture, and things may be completely different from your culture. When someone experiences strong emotions, their skin tone may change color, darkening or becoming rosier than usual. Skin tone change usually starts at the chest and moves up the face. Now, you may be telling yourself, well, what if somebody has very, very dark skin? The reality is you can see this anyway. You can see this as a change in their skin tone. It will become darker. If the darker their skin, it will become darker. You can see it in the areas that are not as dark, like the palms of their hands, the gums, or the nail beds. You can see this, and of course, the more you're around people who have a darker complexion, the more that you will realize this. I've had lots of friends who were of African descent, African Americans, and people from Africa, and I can tell you that the more aware you are that these kinds of changes can take place, the the better at reading people that you become. Facial expression, what emotion do they seem to be displaying? Do they have tears in their eyes? Is the mouth turned up or down? Is the brow wrinkled? Are there circles under their eyes? Are they smiling? Eye movement and eye contact, are they looking mostly at the floor? Are they looking mostly at the ceiling? Are they looking around the room? Are they looking directly at another person? Are they staring? Body position, how are they sitting? Are they leaning back? Are they slumped over? Are they slouched? Are they upright and stiff? Are their legs crossed? Are their feet flat on the floor? Are their legs curled under them? Are their legs crossed? Are their ankles crossed? Anytime something is crossed, it means that they're trying to keep information from you. It's a shield, and they're trying to create a shield. Did they hardly move at all? Did they move slightly? Did they fidget most of the time? Did they nod their heads or swing their legs? Did their movement change during the interchange? Did their breathing seem normal? Did they often sigh? Did they take deep breaths? Did they breathe in a shallow way? Are their fists clenched? Are their jaws tightly closed? Are they slumping? Is their face slack? Has their muscle tone changed during the interchange? All of these things are what you need to observe. Now, if you make a list of these and you go and you're starting to think, oh, I need to check all this off. No, 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 no. It's reading people, and you're reading all of these things at the same time. What were they doing with their hands? Did their hands stay in their lap folded together? Were their hands moving around most of the time? Were their hands in tight fists? Did they make circles with their arms or hands? Did they show their palms? I was just reading an article by Zoe Saldana. I didn't realize that Zoe was married to an Italian. And Italians are really kind of interesting because they use their hands to talk with. So there's always hand movement going on. And she has 4 children, I think. And she says, of course, she's African American. She's from the United States, of course. And she said that her children are taking on they live in Italy, and her children are taking on the attitude of their father and the people that they're around. So they use their hands a lot, and she's just not used to that. And she thought that was really kind of interesting. She's got a little baby, and the babies just fly. Their hands are flying all over the place, and she thought that was kind of funny. Skin tone. Did you notice any change in skin tone? When a group of therapy situation, when you're in a group therapy situation, it is important that the practitioner observe everyone in the group. They should not only observe the individual speaking, but how the members of the group are reacting to what the speaker is saying. When the practitioner scans the group, it also encourages the speaker to speak to everyone, not just the practitioner. Often in a group situation, there will be 2 leaders, and the 2 can trade off assignments of observation. It is necessary to observe the people in large groups. This can be done by looking for telltale actions of individuals or groups of individuals. Are they fidgeting? Is their facial expression incongruent? Are their shoulders hunched? Are their mouths pinched? Are their eyes closed? And of course, when I'm teaching in a classroom, which I haven't done since before COVID, but when I'm in a classroom and I'm teaching, I can tell when my students are I'm putting my students to sleep because all of these things happen. They start to fidget, their facial expression changes, their shoulders hunch, their mouth becomes pinched, and they start closing their eyes. Hopefully they're not looking down at their phones. Attending involves being totally focused on the client. Attending isn't as easy as it seems. Often when we are listening to someone, we are hearing what they are saying, but we're trying to compose what we are going to say when it is our turn to speak. And this is really not what you need to do. You need to be totally attending to them and not thinking about something smart to say. And this is one of the reasons why I tell my students that it isn't the advice you give, it's the amount of listening that you do. The more you talk, uh, the less effective that you are. And so you need to be listening. You need to listen to if you can get your client to say anything, uh, if you can get them to talk, then that's what you need to do. You need to listen to them. So anytime they stop talking and it's your turn, you need to sit there and think about what you need to say. Because if you've been thinking about what you need to say while they were talking, then you're not listening. You're not attending to them. While there are some cultural differences in the way that someone shows attending, for the most part it is shown by leaning slightly forward in a relaxed, comfortable position, sitting in an open and accessible way. Face expresses appropriate concern. And one of the things, and we just talked about the body language, so you can't have your, there you go, okay. Anything crossed, and it means that you're not really listening, that you're cut off from them. So of course that's something that you need to make sure that you're not doing. Facial expressions are extremely important. The facial expression should be congruent to what the client is relating and experiencing. For most people, this comes naturally, but some are taught to smile or laugh at adversity. And of course, that is part of my culture as well, making jokes about bad situations. But then again, one of the jobs that I have had in my life has been in medicine. And in medicine, of course, if you take all the tragedies seriously, then it's going to eat you up. And so one of the things that you have to do is move on. And sometimes the only way that you can move on is to make a joke or smile or laugh. Not at your patients, of course, but at yourself mostly. And that is a bit of a trick. Maintaining regular eye contact is another way that you can show that you are paying attention. People from Asia and those from Northern Europe tend to prefer a more peripheral gaze, finding the direct stare too intense. Any distracting behavior, including taking notes, should be avoided as it distracts from the process. They may see fidgety movements on your part as disinterest, impatience, or boredom. And of course, you certainly don't want to seem bored to your patients or your clients. They will certainly not respond to that very well. Another way to communicate involvement is through minimal encouragement. Minimal encouragement involves repeating one or two words a person says, nodding, or saying something in the affirmative like, uh-huh. And of course, I do the nodding and the uh-huh thing. Listening involves fully focusing on what the other person is trying to communicate. Listening actually goes beyond attending. Most of us are composing in our own minds as others talk to us, but listening is total absorption in what the client is saying. And this, of course, is Pee Wee Herman attending to someone. Listening isn't just hearing the words, but conveying the understanding of the implications of what the client is saying. While listening, the practitioner uses minimal encouragement to get the client to continue disclosing. Remember, the more that you talk, the less that they're talking. And so a successful counselor is someone who doesn't speak very often at all, but allows the client to do all the talking, as much of the talking as possible. Listening involves noticing the client's communication style, including their tone, their volume, the speed of delivery, noticing pauses, silence, changes in patterns of speech. Communication styles vary by culture and between families. Sometimes it's direct, sometimes it's clear, easy to understand. Some use of jargon or colloquialisms, of course, will make it seem uh, more personal. The narrative style, the confused circular manner, jump from one topic to another, do not complete their thoughts. And this, of course, is cultural. When I was working up in Montana, uh, my wife and I visited a healer uh, who put on sweats, and before we were allowed to go to these sweats as participants, he wanted to talk to us, so we went over to his house and we started listening to him, and he told the same story 3 times. And we were able to listen to him without interrupting him, and that's really what he was trying to. That's what he wanted to know. He wanted to know if we could listen to him, if we would actually hear what he was saying. And he did this by repeating the same thing 3 times. And of course, it's difficult to hear the same thing 3 times, but that was what needed to happen in order for us to be uh, approved, to be acceptable. Communication can only take place if you allow the client proper time to express their thoughts and feelings. Silence is good for the client as it allows them to garner their thoughts. Many practitioners are uncomfortable with silence and want to fill it with their own voice. And this is something, if you've ever been around somebody from the East Coast, they like to hear their own voices. It's really hard for them to sit and look at somebody without filling the void with noise. That's somebody from the East Coast more so. Where I'm living now in Iowa, there are the people aren't quite as talkative, or they don't feel the need to talk. So this is just something that you need to think about. I'm not exactly sure about the Southwest. I had a friend who did his research on the Navajo Nation, and he was this Jewish fellow from New York City, and he was studying uh, Native American culture, and he's getting his PhD in Native American studies. As weird as that seems, this guy from New York. Anyway, he came down to the Navajo Nation, and he was talking to this elder, and he had the elder didn't speak English. He only spoke Dene, and so he was talking to him, and he would ask him a question, and they would sit there, and he had a difficult time keeping his mouth shut and letting the elder think. Uh, and he asked him, and sometimes it would take him minutes. It would take him, a number of minutes to come up with an answer to his questions. And so he asked him the question, "Why does it take you so long to come up with an answer?" And the guy said, Stu, your questions are so interesting that I want to give you a really good and thorough answer, and so that's why I think so long. And that taught him, of course, despite the fact he was from New York City and had a very difficult time accepting silence. It taught him to shut up and let the elder think. Even when practitioners are fully focused on listening, they may misinterpret the client's words. A client may use emotional words differently because of cultural or familial imperatives. Interpretation must be explained by the client. What the client says affects the practitioner. It is important for practitioners to listen to their own responses as a way of further understanding what the client is saying. If a client is speaking in a monotone about something very sad and the practitioner does not experience any personal response to this, it is important to determine whether the client is allowing himself or herself to feel the feeling or the practitioner is detached. And this is something that you need to be able to observe this. Warmth is expressed through your demeanor, the concern that you show, the acceptance that you show, your tone of voice, your posture, the fact that you're listening carefully. And touch can be a way of expressing warmth when this is used appropriately. Now, this is usually okay between males and males and females and females. But if it's a male and female situation, then touch is probably not something that you should be doing. Um, it sometimes is misinterpreted, so you need to be careful. The appropriate expression of warmth can depend on many diversity issues. Gender influences how warmth is expressed, particularly this is influenced by various religious or spiritual beliefs. Racial and ethnic differences and cultural norms influence the expression of warmth. The power differential between different people can confuse how expressions of warmth are interpreted between a child and an adult, a doctor and a patient, or a person with perceived economic power with one who does not have this. And this is one of the reasons why, if you've been observing Donald Trump over the last 6, 7 years, or maybe even before that, he has a difficult time understanding other people. This is because he's always had a lot of money, and wealthy people expect people who don't have as much money as them to act in a certain way, to act in a form of deference to them. And this is one of the reasons why it seems that Donald Trump can't understand he can't understand people. He tells them what to think. He doesn't hear what they have to say. As curious as that is, that has to do with economic power. This has always been the way it is. Why do we act deferential to wealthy people? I grew up in a blue-collar town, and I went to a fairly elite school where there were a lot of wealthy people. Well, most of the wealthy people I drove away from me because I treated them just like everybody else, and they expected me to treat them with deference because they had money. And when I went to my college reunion, I was getting the same reaction. I'm a professor. I make a certain amount of money, which isn't that much, and I was trying to talk to people who were lawyers who had made millions of dollars and doctors who had made millions of dollars, and they really didn't appreciate the fact that I wasn't acting deferential toward them. It was really kind of curious. The easiest people to talk to were other professors or other educators. We kind of sat around and talked to each other. And all those wealthy people just kind of, sat around in a big circle and talked to each other. But if we tried to talk to them, they acted like we were invading their space or something. Really kind of weird. Expressions must be genuine due to the way the brain functions and thousands of years of history. Individuals are quickly able to pick up warmth that is not genuine. It is important for the practitioner to observe the client's response as a way of judging how warmth was experienced. Level 1, the practitioner communicated little or no concern for the client and appeared cold, detached, stiff, and or mechanical. Level 3, at least half the time, the practitioner verbally and non-verbally communicated concern and caring appropriate to the unique needs of the client. Level 5, the practitioner's facial expression and posture consistently communicated concern and caring appropriate to the unique needs of the client. And you can do this with eye contact. Now, in your culture, this may not be appropriate, but as for me, as someone who is a military veteran and as old as I am, eye contact is possible as far as I'm concerned. That's because I'm so old. The meetings of Anna, and here are some facial expressions. This is really kind of a fascinating movie. It's a French movie, and we get to watch Anna, the facial expressions she has. This is her smoking. As you can see, she looks a bit depressed. And the reality is she is depressed. She's trying to sell her movie. And she's traveling around to Europe. She travels to Belgium, and she's in France, of course. She goes to Berlin. She goes to Vienna. She goes around visiting all these people that had accepted her before, and now she's trying to sell her movie to get them to show her movie. And as you can see, this is her when she first starts out. This is her when she first starts out. And of course, she's still depressed. She's in Berlin, and she's just met a man that she had an affair with before. She's married, but she has found out that her husband is having an affair, and she's trying to decide what she's going to do next. And this is her at the end of the movie. She has decided that she's going to move in with her girlfriend and divorce her husband. Really an interesting movie. The facial expressions that this lady gives off are really intense. Now, normally when you watch a movie, of course, these are actors, and sometimes they don't have the emotions that they're supposed to have. And of course, the better the actor, or the more intense the part, the more likely you will see the proper facial expressions. But this lady just did a fabulous job. So, and I can't remember what it is in French. But if you ever have an opportunity, of course, it's all in subtitles. And she does have an affair. And she calls her girlfriend, and she asks her if she can meet her someplace in Belgium, I think. She meets her mother as well. And of course, she's estranged from her mother. Her mother wants her to be successful and to stay in a relationship where she is taken care of. Really fascinating movie. Okay, that's the end of chapter 6. So let's go on to chapter 7. Preparing for the client and ending a session. Uh-oh, what's that expression? The practitioner must get ready to meet with clients. They must gather referral information. They must gather the forms that they need. They must gather their needed supplies. The purpose or agenda for the meeting is clarified. This is the reason we are meeting. The practitioner must consider the client's needs in the physical arrangement of the building, the waiting room, the meeting room. If the client has any physical limitations, then the practitioner must make appropriate alterations. And of course, if they're in a wheelchair, there must be an elevator. They certainly can't go up the stairs. The client's culture should be considered to ensure that all appropriate steps are taken to make the session as beneficial as possible. If the practitioner does not have a working knowledge of the client's culture, then it is appropriate to research the culture with the understanding that such writing is often stereotyped and inaccurate. So just because it says that Chinese people eat noodles, or I'm not sure where they eat katydids, or they eat hot dogs. Not all Americans eat hot dogs, of course. The practitioner needs to understand how the client may feel about the first meeting. They may feel embarrassed, hesitant, or uncomfortable. The practitioner must put away all distracting thoughts so that they can concentrate on the needs of their client. And this is part of the warmth and the genuineness. Beginning the first meeting appropriately is essential to the client-practitioner relationship. The client-practitioner relationship. First impressions have lasting effects on future interactions. The greeting is essential to connecting with them. First impressions never die, except those flowers are dead. Ground rules need to be clarified. The purpose of the meeting, the length of the meeting, any special considerations that need to be addressed. When greeting the client, be aware of the loudness of your voice, the eye contact that you have, and how you address them. Issues of privacy and confidentiality are important in how you first meet your client. You must identify a person in a waiting room and cannot guess who your client might be. You can say very quietly, "I am Jesse Melendez. Are you Mrs. Chin?" If a receptionist is able to identify your client, you can just identify yourself to the client. Be aware that many clients experience some shame in seeking help, so confidentiality is very important. The practitioner should invite the client to introduce themselves. The practitioner should determine how the client wants to be addressed. Some people don't like to use their first names. Using a last name in any circumstance shows respect. What was I reading the other day? It was about Mr. Rogers. When Mr. Rogers talks to children, he always gets on their level. This is something they were talking about with Kate Middleton, Prince Prince William's wife. When she talks to children, of course, she was an elementary school teacher. When she talks to children, she always gets on their level. So she's looking face to face. She's not towering over them. And of course, that is usually appreciated by children. People tend to feel more comfortable with professionals who fully explain the process, what they're going to do, what will be expected of each person participating, the purpose of the meeting, and the limits of confidentiality. And there are limits to confidentiality. When beginning meetings with children and adolescents, explanations will need to be made that they can understand. Special issues of confidentiality will need to be covered. Education about your role is important, as well as what you expect of them. How you will include their parents or caretakers also needs to be made clear. First meetings with groups and families, be sure that the members of a group are acquainted with each other. Clarify ground rules for talking. Explain what the role of participants will be. In families, you may want to ask how the members want the family to be different. Confidentiality needs to be discussed and an agreement reached about how information will be shared outside the group or family. For subsequent sessions, some practitioners like to start their sessions by allowing their client to initiate the conversation, thus setting the direction of the meeting. They may say, "Where would you like to start?" Or, "Let's begin by discussing the progress you have made since our last meeting." Confidentiality is one of the most important elements to address at the beginning of the first meeting. You need to assure the clients that information shared with you will be kept confidential, secure, and not shared with others unless they sign a consent form. One of the hardest areas for clients to understand is mandated reporting of possible harm or self to others, suspected child abuse or neglect, and elder abuse. Begin your discussion of confidentiality by covering the legal limits of your state, and each state has different limits. So whether you're living in Colorado, Utah, Arizona, or New Mexico, whether you're practicing in one of those places, you need to explain what that state dictates as far as confidentiality is concerned. Explain the boundaries of confidentiality. Most agencies will have a statement of confidentiality and informed consent that clients must sign during their first appointment. If a client is mandated by the court to see the practitioner is required to report back to the court. So if someone is told to be that they need counseling for drug abuse, and the court has dictated that, then you're going to have to give reports to the court as to how well the client is doing. If the client is considered a minor, the parents or guardians usually have the legal right to know what happens in a session. Each state has their own laws regarding sharing information with parents. Many practitioners will only disclose information that the child's behavior is a threat to themselves or to others. Recently, things have changed with the since they overthrew Roe v. Wade, one of the things that some states have, some laws in select states have been that if a child is pregnant and they're under the age of 18, then they have to tell their legal parent or guardian, no matter what the situation is. They have to tell them. They have to disclose this information. Whether they're married at 17 or 16 or 17 or not really doesn't make any difference. The state tells you that. And of course, these are new laws. So with laws changing and becoming more conservative, then it's really important for you to determine how your state views the legal limits of a minor or of a minor. Possible problems the minor could disclose: being sexually promiscuous, of course, using drugs excessively, threatening to run away, having been abused or neglected, feeling suicidal or feeling homicidal. Now, if they feel homicidal or suicidal, this is one of the things that you have to tell that you have to deal with. If they are threatening someone else or threatening themselves, then it is your duty to make sure that they don't hurt somebody, either themselves or someone else. If they have disclosed that they've been abused or neglected, then this is information that you have to inform the legal authorities. If they've been abused, well, that has to do with abuse. The drugs you don't have to disclose. Threatening to run away, you don't have to disclose. If they disclose that someone in the family has been abusing someone that's over the age of 65, I believe, in most states it's 65, then that's elder abuse, and that has to be disclosed to the authorities as well. Groups create additional issues in confidentiality. Confidentiality must be discussed during the first meeting. Most practitioners recommend that the group members agree not to discuss information covered in the meeting outside the group or with anyone in the group after the meeting has ended. Many organizations require administrative contracts, which may include detailed descriptions of the nature and limits of confidentiality, explanations of when disclosure is required by law, what to do in case of emergencies, payment terms, confidentiality of records and email communications, rights of the client to review records, telephone and emergency procedures, cancellation policies, information about the practitioner's qualifications, training, education, and licensure. Other information that the client needs: they need to understand payment. They need to understand what happens in an emergency, telephone or email contact, how contact between sessions will be handled, cancellation policies, and length of meetings. The closing of a session is just as important as the opening minutes. The practitioner may want to discuss possibility of future meetings, what has been covered in the sessions, and request feedback. Ask a client what has been helpful, support the client's courage. Keep in mind that different cultures have different expectations. Closing statements that you may use: how would you like to end today? We have 10 minutes left today. This seems like a good place to stop today. We've talked about some important things today. Although we need to end for now, it seems like it might be helpful to continue our discussion next time. We have 15 minutes left. Do you have any closing thoughts about our meeting today? Let's talk about what we have accomplished today. What did you find most helpful in our work today? I would recommend that we meet weekly for the next 4 weeks and then evaluate our progress. Does that plan sound okay to you? We are about out of time and have covered most of the points on our agenda. I think this is a good point to end. Shall we meet again next week at the same time? And that is the end of that chapter. So I will talk to you again next week. I'm sure we'll tackle at least chapter 8, if not chapter 8 and chapter 9.